Welcome to week 11 of pregnancy. You know, in this whole incredible story of new life, this week is a huge turning point. The pace of development, it's just breathtaking. We're shifting from those very first foundations into a time of super fast refinement. So let's jump in and see what this amazing milestone is all about.
Okay, just look at this. Wow. By week 11, your baby is starting to look so much more, well, human. The head is still pretty big compared to the body, but you can see it's more separate now. And get this, those tiny little hands can even be brought up to the face. It's just a remarkable, remarkable sight.
So what's really going on here? I mean, what does all this mean? We're leaving those early foundational stages behind and jumping headfirst into a period of super fast refinement. So let's break down what's happening for both your baby and for you.
All right, first up, let's talk about the star of the show, your baby. Their growth right now is, well, it's nothing short of explosive. We've officially entered what's called the fetal stage. All the basic building blocks are in place, and now things are about to get really interesting, fast.
And here's the proof, right here. I mean, this is just incredible. On the left, that's your baby at 9 weeks. And on the right, just 2 weeks later at week 11. Look at the difference, the proportions, how defined the arms and legs are. It's a huge leap in such a short amount of time. So to put a number on it, your baby is now about 2 inches long from the top of their head to their bottom. That's about 50 millimeters. And think about this. All of this incredible, complex development is happening inside something that's only about the size of a fig. Isn't that wild?
And this growth isn't just about getting bigger, it's happening on so many levels. For example, the neck is getting longer, which lets the head move around a bit more. The diaphragm is fully formed, so your baby can actually start making these little practice breathing movements. And inside, crucial things are happening too. The ovaries or testes are beginning to form. So much is going on.
And because those little limb joints are all formed, your baby is kicking and stretching in there. They're having a little party. But, and here's the catch, even though they're super active, they're still way too small and light for you to feel any of it. That amazing moment when you feel the first kick, it's still a few weeks away, but it's coming.
And it's not just about movement and growth. The senses are starting to come online. How cool is that? Tiny taste buds are popping up on the tongue, and the ears are slowly moving into their final spot on the sides of the head. It's like the body is laying down all the wiring for a lifetime of seeing, hearing, and tasting.
Okay, so with all this incredible stuff happening with the baby, let's switch gears and talk about your journey, because you're entering a new phase too. Around this time, you're probably gearing up for your first big prenatal appointment, and this one is really, really important for planning out your care for the next several months. Yeah, you can really think of this as your big strategy session with your care team. They'll go over your medical history, you'll map out a schedule for future appointments and tests, and honestly, the most important part, it's your chance to ask all the questions. Seriously, no question is too small.
Now, at that appointment, you're going to hear about different kinds of tests, and it's so important to know the difference between the two main types. So, you've got screening tests. Think of these as a heads up. They check the risk or the chance of a problem, and they're usually simple, like a blood test or an ultrasound. Then you have diagnostic tests. These are the ones that can give you a definite yes or no answer, but they can sometimes be more invasive. So one is about probability, the other is about certainty.
So a perfect example of a screening test you might be offered right around now is the neutral translucency scan. It's a mouthful, I know. Basically, it's an ultrasound that measures a tiny, fluid-filled space at the back of the baby's neck. And when they combine that measurement with a blood test, it's actually remarkably good at assessing the risk for certain conditions. We're talking 80 to 95% accurate. Pretty amazing technology.
All right, let's step out of the doctor's office for a minute and talk about your day-to-day health. Because taking care of you right now is just as important as all the baby's development we've been talking about. Let's get into a few key things to keep in mind for your own well-being.
Okay, have you ever heard that old saying, you lose a tooth for every child? Well, don't worry, it's not literally true. But like a lot of old wives' tales, there's a little grain of truth in there. See, pregnancy hormones, especially one called progesterone, can actually soften your gums. This can make them more likely to bleed or get inflamed. So staying on top of your dental health right now is, more important than ever.
Now, here's a big question we hear a lot. What if you're allergic to dairy or just don't eat it? How are you supposed to get all that calcium your baby needs for their tiny little teeth and bones? It's a really important question. So what are the options?
Well, luckily, there are some fantastic options out there. For calcium, you can load up on leafy greens. We're talking broccoli, kale, and even fish with soft, edible bones, like canned salmon or sardines. And for those other nutrients you'd find in milk, like vitamins A and D, you can get those from brightly colored veggies, eggs, and most types of fish. So you've definitely got choices.
Okay, what about traveling? Can you do it? Absolutely. But preparation is everything. This is a great little checklist to keep in mind. First, always chat with your doctor. Make sure your travel insurance specifically covers pregnancy. And always, always carry your prenatal records with you. Oh, and a couple of pro tips. Don't sit still for too long. Get up and walk around to keep your circulation going. And of course, stay hydrated and maybe think about some comfy support socks.
All right, now let's take a moment for a special focus. For all of you out there who are expecting twins, first of all, congratulations. It's double the joy for sure. But it also means your journey will have some unique aspects and a need for some extra care.
One of the key things with identical twins is that sometimes they can have what's called a monochorionic pregnancy. It's a big word, but it just means the twins share one single placenta. And because they're sharing that life support system, it's super important for your medical team to monitor them much more closely.
And the reason for that close monitoring is to watch out for a rare but serious condition called twin-to-twin transfusion syndrome, or TTS for short. This is when the blood flow through that shared placenta becomes unbalanced. One twin gets too much, and the other gets too little. Now, it only happens in about 10 to 15% of these shared placenta pregnancies, but it's exactly why those extra checkups and scans are so important.
And on a more day-to-day level, if you're carrying twins, you might find that the first trimester is, well, a bit more intense. Those hormone levels are higher, which can mean more morning sickness and feeling extra tired. So just know that's totally normal. You can also expect more frequent doctor's appointments and maybe some limits on things like travel or intense exercise as your pregnancy moves along.
So when you boil it all down, week 11 is really like a bridge. It's that moment you cross over from the very earliest stages of development into a whole new chapter, a chapter where you're carrying a tiny, active, and very recognizably human little person in the making. You know, from those first kicks you can't feel yet to those tiny taste buds forming, this week is just packed with these incredible hidden milestones. So as you take all of this in, I want to leave you with a question. What's one thing you'll do this week to just pause and really connect with this amazing journey you're on? Thanks so much for joining us.